You will now be given the opportunity to practice what you've learned so far with an actual case study. Ben has been brought to the clinic by his mother. Ben is age 7 months. He weighs 6 kilograms and his temperature is 38.5 degrees. His mother says he has been coughing for 2 weeks. First, check the child for general danger signs. The mother says that Ben is able to drink, is not vomiting, and has not had convulsions. Look at Ben to see if he is lethargic or unconscious. Write down your assessment. Does Ben have any of the general danger signs? Now, assess Ben for the main symptom of cough or difficult breathing.
Does the child have cough or difficult breathing?
Ben has a cough. Therefore ask,
for how long?
Ben has been coughing for 2 weeks, and the cough is getting worse. Count the breaths Ben takes in 1 minute. Prepare to start counting. Start counting now. Stop counting. Write down the number of breaths you counted and decide whether Ben has fast breathing. Now, look for chest in drawing. Write down whether chest in drawing is present. Assess Ben for stridor. Look and listen now. Write down your assessment. That completes the assessment process for a child with cough or difficult breathing. You should now use the signs to classify the illness. Look at the section of the classification table for cough or difficult breathing. Choose the appropriate classification for Ben and write it down. We will now tell you our assessment and how we classified Ben's illness. Ben is age 7 months. His mother told us that she brought Ben to the clinic because he has a cough. First, we assessed Ben for general danger signs. Ben was able to drink. He was not vomiting, and he did not have convulsions. Ben was not lethargic or unconscious. Ben does not have any general danger sign. What did you decide? Next, Ben was assessed for the main symptom, cough or difficult breathing. Ben had been coughing for 2 weeks. We counted 55 breaths in 1 minute. As Ben is age 7 months, he has fast breathing. Ben has chest indrawing. We could hear no harsh sound as Ben breathed in. Therefore, we decided that Ben does not have stridor. Ben has a cough, fast breathing, chest indrawing, and no stridor. We use these signs to classify Ben's illness on the classification table. Look at the signs listed in the pink row. Always look first at the top pink row. Ben has chest indrawing. Therefore, we classified Ben as having severe pneumonia or very severe disease.